Hello, my name is Bill Haley, and this is part of my 3-minute introduction series into Haley 2024 The Movements, Government Reform Ideas. So let's discuss this real quick. This is going to be on the healthcare sectors, with 2 sectors within healthcare because it's so big of a sector. It takes such a big part of our economy, and it's so important. So let's take a step back and let's make sure everybody understands that we take all government power, federal, state, and local levels, and we change it into we split it into 30 sectors. Within the healthcare, we have 2 sectors. We have insurance has a sector. We get rid of all government welfare and switch to a charity model that is funded by some mandates. So we have a full system. So there's a lot of sectors that are involved in healthcare, from the charities, from labor law to healthcare to financial to insurance and the like, family law, and so there's a lot of sectors involved. Within each sector, every single sector, there's 12 distinct competitive regulatory agencies. These are full governmental units. These are representative units, agencies, and they are full governmental units with executive, legislative, and judicial powers. So that's so important to know. So important to know that everybody must pick one of the CRAs, competitive governing agencies, and they must, and CRAs only governs their members. They only require fees from their members and give benefits to their members. So within each one of these sectors, there'll be competing agencies competing for your business of regulations, of governance, of healthcare law, of insurance laws, and charity law, and all the stuff, charity services and different things. So let's go over this a little bit. So every healthcare agency will be working with the charity system. They'll be working with the insurance sectors, so their counterparts in the counterpart CRAs in the insurance sector. They're going to take away almost all healthcare away from employers. Employers should never get so involved in healthcare. We need to take that away, and I think that will be done naturally. We don't have to force that by government edict. It's going to be something that's naturally going to come away when we stop doing a lot of the benefits for employers to get into it. The competition of different regulations are going to be tremendous, and that's going to get rid of a lot of negative, hostile, and ineffective regulations and really increase the number of good regulations. The insurance games, a lot of healthcare companies play insurance games to try to get the most amount of money. That can only be done when there's a heavy monopoly, and there is a heavy monopoly right now within insurance, within government, within a lot of different things. With a more competitive nature, a lot of that goes away. Illegal drugs, we address that in a very unique way. Because we have a competitive FDA, Food and Drug Administration, approving different drugs. So that's going to be a much better system, and it takes a 70% to make a drug illegal. So that's going to make a lot better system. Anyway, we're past my 3-minute limit on my Haley 2024 introduction series. So keep on looking around my website and other videos. Thanks a lot.